Hey guys, happy Tuesday. This week I want to talk a little bit about preventive care and how that works with insurance. So, I've recently had a client call me because they went for, it's a female client, went for their annual checkup. Um, and the doctor convinced her to do all these extra tests, said, your insurance is preventive, your insurance will cover it. Well, guess what? Insurance didn't cover it. And, this is someone that hasn't had a lot of experience with insurance because they're young. And if you don't have experience and you're going to take the doctor's word for it that, oh, my insurance is going to pay for it, so why not do the tests? Well, these particular tests, this patient had no previous history of any of these issues. And no concern about having any of these issues. And I'm not talking about high blood pressure or any of those kinds of things. I'm talking about basically sexually transmitted diseases. The doctor ran all these tests. This client had no previous history, had no concerns about any of these things, but convinced her to do these tests because it's covered under preventive, and now she's receiving a bill for over $600 from this physician's office. I'm helping her working on getting this resolved because one, the doctor shouldn't be telling patients what's covered and what's not covered because they do not know. Hopefully insurance department knows, and maybe if they had checked with the insurance billing staff in his office, he would have known that maybe that wasn't a covered thing. But the thing that really irritates the heck out of me is the upselling. So, doctors want to make more money. I get it, but doing procedures that are unnecessary is not cool. And then sticking a patient with the bill for it is certainly not cool. And you as a patient need to know what's covered, what's not covered. If someone tells you, oh, let's do these extra things because your insurance will pay for it, that's a red flag. Because just because your insurance may pay for it doesn't mean it's necessary. The attitude that, well, insurance is just going to pay for it, it's not costing me anything, is untrue. Because the more claims that are filed, whether it's preventive or illnesses or whatever, the higher the premiums are going to end up being on your insurance. So it is not free. It is not free. All that preventive stuff is figured into your premium. People do not realize this. So it's not okay to go, oh, it doesn't matter, I'm not paying anything. Well, you will pay for it one way or the other. So part of, I feel like, helping educate people is, if the doctor recommends something, ask why. And then if you're not sure your insurance will cover it, just say, hey, can I do this next time I come? This way it gives you an opportunity to check and see what is covered by your insurance and to make sure you don't end up with a big bill. Again, it's really not cool that this office did that. I've already had the client call the office, and the billing department was no help. They tried to blame it on the insurance company. And I'm like, no. This is your responsibility to not tell patients. If you don't know, then you shouldn't be telling patients, let's do this procedure because it's covered. So there's some liability on the doctor's office. They have accountability for this. It's going to take a little bit to sort it all out with the insurance company and with the doctor's office. But this is where the patience is required because people freak out. They're getting these bills. They're worried about being turned into collections. Well, this whole thing was done in not a very cool manner. And so I'm trying to help educate this particular client on, well, it's going to take some time, but we're going to get it worked out. And I don't see why you need to pay this much money. This client has also already paid money. The billing is terrible. I've looked at the billing, compared the billing to what was billed to insurance. It doesn't even look like they've applied all the payments. The whole thing is a mess, a big, big mess. and that I'm trying to help figure out. So really the takeaway from this is just because something may be covered by your insurance doesn't mean it's a necessary procedure. We all have to do our part to help keep healthcare costs down and help keep premiums down. I want people to get treatment to you know, if you can do screenings and prevention to prevent certain things, that's awesome. And sometimes those things are warranted. But a 26-year-old who has no history and no concerns about sexually transmitted diseases does not need 4 sexually transmitted disease tests to determine that she actually doesn't have sexually transmitted disease, which she already knew. It's very unfortunate that this happened this way, but we just all need to do our due diligence. If something just doesn't feel right, you can refuse tests. I'm not saying the doctors don't know, but unfortunately there are some practitioners out there that are just going to run everything under the sun because they feel like they can collect that money from insurance. Thankfully, they're few and far between, but it does happen. So it's up to you as a patient. You have right of refusal. I mean, if their standard of the doctor's office standard of what they do for everybody, that may be a red flag. The state medical board may want to know about this, but I'm hoping it doesn't get to that point. I really just want to help this client out and make this office aware that they should not be relaying this information to a patient if they actually have not verified benefits. And even then, when you verify benefits, there is no guarantee of payment, no matter what insurance company you have. If you've ever worked in the insurance realm, from an office standpoint, you know when you call to verify benefits, the disclaimer says, this is no indication of payment. We not guarantee of any kind of payment until we receive an actual claim. So that's the insurance company's way out of not paying things until they receive an actual claim, because they need to look at diagnoses. When you're calling to get information, it's just really you're getting information. You're getting a generalization, not based on a certain circumstance, because a certain circumstance isn't known until the actual claim is billed. So big heads up when you're having your office visits, physicals, all that stuff done. Get what you need done, but ask the doctor why we're doing certain things if you feel like they're overdoing it. And certainly try to find out what your insurance covers. Obviously, there's no guarantee of payment, but if they're doing some basic routine stuff, a lot of those are covered, but there's limitations even on those, because sometimes they'll only pay for certain tests once every so many years. So these are all important information to know. Know what your risk factors are, and that'll help determine a conversation with your doctor which tests are appropriate for you. Until next time, peace out.